For this Call the Care Provider activity, I have 3 just whatever type cups, and I've labeled them. This one says Call the Care Provider. This one says maybe or it depends. And this one says common or normal. And what we're going to do in our class is we are going to hand out some of these tongue depressor sticks. You'll see they all have scenarios written on them. I've got about 30 sticks here, and it's kind of like 2 activities in one, because half of these sticks are about the parent's postpartum recovery and half of them are about baby during the postpartum period. So if you wanted, you could separate them, or you could put them all together if you wanted. And we're going to hand out, you can give each student a handful of them, and they can look them over. They're going to read them out loud as a group to the group, and then they're going to decide which cup it goes in. So this one says baby looks drunk after feeding, and we know that that's actually a sign that usually they're very satisfied when they're feeding, so that can be common or normal. Baby has some blood in their diaper. This can be really scary for people when they see this, but we know that especially little girls, that this can be common in that first week after they're born. So it kind of depends. If they're having blood in their diaper weeks after, it could be a sign for concern. So we're going to put this in the maybe category. But let's just say during the first week, baby sleeps all night with no feedings. If babies are being fed at the breast, then we really need babies to be waking up more frequently. So sleeping, 8, 10, 12 hours in that first week might not be appropriate. So generally we're going to go get baby checked out at that point. So that's what we do together. Everyone's just going to decide which cups these sticks go into, and it creates a nice discussion piece, possibly even a debate sometimes, because somebody in your class might say, oh, well, my sister had that and there were no issues with it. And that gives you a chance to actually talk through some scenarios with them as well. Very simple activity and a lot of fun for reinforcing and helping them think through what is common and what might need to see the care provider.